From acupuncture and Ayurveda to chiropractic and massage, these are just some of the most common forms of alternative medicine in the world. But if we look closely at the Pearl of the Orient Seas, a traditional Filipino healing art form that started approximately 1,000 years ago is still prominent and very much embedded in the culture as of today. That is Hilot. Hello and welcome to Questions and Everything. Today, we will unveil the history and the science behind the healing hands of Filipinos. To answer the question, what is Hilot, really? Hilot is a traditional Filipino practice of healing. It involves manual therapy, often in the form of massage, joint manipulation, and herbal remedies. It is used both to treat physical ailments like muscle pain or sprains, to promote overall wellness, and to restore the balance in the body. Long before establishing clinics and pharmacies, early Filipinos turned to babaylans, the spiritual leaders, and albularios, the herbal healers, who practice hilot to treat illness. This approach went beyond physical care. It included spiritual alignment, herbal remedies, as said before, and touch-based diagnostics, all grounded in the beliefs about balance between the body, nature, and spirit. During the Spanish colonization, indigenous practices were pushed to the side. Still, Hilot stayed alive. It absorbs elements from Chinese medicine and Ayurveda, including pulse diagnosis, herbal pharmacology, and elemental theory. It remained a community-based and guarded tradition, often passed orally or through apprenticeship within families, particularly in remote places where modern medicine was either hard or too expensive. Hilot is not just a typical spa massage. It's a healing system that is highly personalized. For practitioners like Apwad Man Aghama, healing isn't just about following a set of process. It's all about getting the energy aligned between the healer, the spirits, and the patient. He also mentioned that it does not claim any therapeutic cure, and the manghihilot, or the healer who practices hilot, only serves as a healing minister. They're there to remind us that we have the power to heal ourselves. As shared at the Hilot Academy of Binabaylan, traditional and evolving techniques aim to enhance body and energy circulation, promote detoxification, relieve muscle stiffness or pain, and stimulate the immune response. These techniques include palpation, to locate tight or cold areas, also called as lamig. They are believed to indicate blocked energy or poor circulation. Application of medicinal coconut oil, also known as lana, they use deep and directional strokes with this. Cupping is also present, such as bentusa, horn suction called as tandok, or even oral suctions in some cases, also called tawak. There are spiritual interventions such as prayers, using of amulets called anting-anting, or chanting rituals. Is there any science behind Hilot? Let's find out. While there's not a ton of formal research out there yet, some new biomedical findings are starting to support parts of Hilot. Hilot uses techniques similar to myofascial release and deep tissue massage, which are both aimed at loosening tight muscles and connective tissues. They can improve movement and also reduce pain. These techniques stimulate the following. First, the mechanoreceptors. These are the nerve endings in the skin and muscles that detect pressure or stretch. When activated, they send signals to the brain to reduce the pain sensation. Take, for example, rubbing our elbow after bumping. It actually helps because these receptors interrupt the pain signal, and this is part of the gate control theory. Next is the lymphatic drainage. Gentle pressure helps move lymph fluid, which carries waste products and immune cells. This supports the body's natural detox system and may reduce swelling or bloating, especially after illness or injury. Lastly, we have vasodilation. This refers to the widening of blood vessels, which improves blood flow. Better circulation just means more oxygen and nutrients reach damaged tissues, speeding up the healing process, kind of. There are also neurological effects too. The deep pressure stimulation used in Hilot affects the brain and nervous system, similar to how some forms of massage or physical therapy work. It may lower cortisol levels. Cortisol is the stress hormone. High levels are linked to anxiety, poor sleep, and the weakened immune system. Lowering it helps us feel calmer and more resilient. Another thing is the increase of oxytocin, often called the bonding hormone. Oxytocin promotes a sense of connection, trust, and emotional comfort. This may explain why Hilot is often described as both physical and emotionally healing. The activation of the parasympathetic nervous system has some effects. This is the rest and digest mode of the body. When triggered, it slows the heart rate, relaxes the muscles, and helps the body recover. So basically the opposite of the stress response. Hilot is gaining recognition in public health discourse such as the Philippine Department of Health, DOH, includes Hilot under traditional and complementary medicine, as a formalized in Republic Act No. 8423, Traditional and Alternative Medicine Act of 1997. Some rehabilitation centers and wellness clinics now combine Hilot with physical therapy and clinical care. The Philippine Institute of Traditional and Alternative Healthcare, also called PITAC, works to standardize training and research protocols for traditional modalities, including Hilot. Hilot still stands at a critical position due to some of these limitations, which include lack of standardized training or accreditation. Unlike licensed health professionals with national boards and certifications, Hilot practitioners often learn through oral tradition or apprenticeships. This leads to inconsistencies in methods, ethics, and safety protocols, making it difficult for patients and the health system to know what level of care to expect. Most evidence supporting Hilot remains anecdotal. Without rigorous scientific studies, it's hard to prove its effectiveness in a way that the global medical community can accept. Next is the medical skepticism about spiritual or metaphysical components. Elements like prayers, energy alignment, and the use of amulets or anting-anting are viewed with caution, sometimes outright dismissal. These spiritual aspects, through central to Hilot, are hard to measure using conventional medical tools, creating a gap between belief based healing and evidence based practice. Another impediment is that only few institutions offer formal educational pathways. While groups like the Hilot Academy of Binabaylan are pioneering structured programs, most universities and health schools do not yet include Hilot in their curriculum. So what now? Should you try it? Well, Hilot is not a miracle cure, but it is a living tradition, a community-driven approach to wellness, and for many, a vital tool for survival, especially where healthcare access is difficult. As modern science catches up and practitioners elevate standards, Hilot may soon find itself not just preserved in memory, but practiced and recognized in integrative health clinics, maybe even research centers around the world. It may very well become one of the models for culturally grounded, low-cost healthcare rooted in ancestral wisdom. And hopefully will continue to evolve through modern understanding. What about you? What do you think about Hilot? Do you have anything similar in your culture? If so, please do share. I'd love to hear it, and thank you so much for watching. I hope you enjoyed learning something a little bit about my culture. I definitely did. And until then, see you soon. Take care and have a great day. Salamat po!